Hello, everybody. We are back with another very important information about COVID. For the last 2 to 3 weeks, people in New York have started seeing young kids, mostly teenagers or even younger than them, presenting with high fever, cracked tongue, bloodshot eyes, and they had to be admitted in the hospital. And in the hospital, they were found to have multi-organ inflammation. The blood vessels were inflamed. There's a disease that was described first by a Japanese called the Kawasaki Syndrome way back in early this century. Um, this disease was like that. So initially they did not know what it was, but later on it was found that it's possibly a syndrome that is secondary to COVID. As you all know, that it has been said that COVID does not involve young people. That's true. Most of the young people, 99% of them, may get infected with COVID, but they do not present with any symptoms, and certainly they don't die. But this is a new syndrome that was seen for around 10 to 12 patients in New York. They saw a similar number of patients in Italy. Initially, the doctors did not know what it was, but later on, they found that all these patients were actually COVID positive, or they had family members who were COVID positive and they presented with this sort of symptoms. Now, this is not the first time that this scenario was seen. They had noticed this a couple of months back in Italy, Spain, and some of the other countries, but initially they did not know what it was. It was actually misdiagnosed as something like Kawasaki's disease, which, as I said, is a disease where there's inflammation of blood vessel. But now we know this is possibly a syndrome secondary to COVID that is found in children. So, especially in India, if we do find kids presenting like this, it's not anything else but must maybe secondary to COVID. The other important thing to understand also is that we are progressing with the treatment of COVID. Another drug that recently was found to be working is what is known as Interleukin-6 inhibitor. That's a complex term, but I'll just explain what it means. So it's important to understand that COVID virus itself doesn't kill anybody. After it infects a body, the body initially fails to realize that it has been infected because the virus suppresses the immune system. By the time the body realizes that a foreign element, an alien, has invaded it, and it's an evil guy who has invaded it and taken over control, then the body reacts. But when it reacts massively. It releases a whole cascade of chemicals. Among them, the most prominent is what is known as interleukin 6. This chemical, what it does is it starts a plethora of inflammation in the body, causing damages to the body's own system, like lung, like heart, like kidneys, blood vessel. So there's a massively triggered inflammation that goes on, and that is what ultimately kills, because the body's own inflammatory process kills the body, not really the virus. It certainly is triggered by the virus, but the virus does not directly kill. It kills because body reacts badly to it. Now, we know this because a ton of research has clearly shown interleukin is increased in these patients with moderate to severe COVID disease and those who have died. So now we have a drug called Tocilizumab. Another drug is being tried called Salizumab. This can block interleukin-6 and can prevent death. But the funny part is that we still do not know when to use it. Because remember, body's immunity is important to kill and throw the virus out. So if you use these drugs too early, you are going to block the body's immunity, which will actually be responsible for killing and throwing out the virus. And if you use it too late, then the patient might die, or by that time the damage is already done by interleukin 6, and you already have a damaged lung, damaged kidneys, damaged heart. Some people have their heart swelling up like a massive balloon and can also rupture, and they die. At that time it is too late to give any medicine. So now we are trying to find out what is the right stage where this medicine can be used. I'll stop for today. I'll continue to bring in latest information on COVID. If you have any questions, don't hesitate to get back, write to the editor, and I'll be more than happy to answer all your questions.